Hi guys, I'm Dr. Ayele Okine and this is This Vet Wants You to Know. Today we're talking all things liver. We see a lot of dogs and cats that come in with liver disease, and you'd be surprised. It runs the gamut from infection to inflammation like autoimmune diseases to cancer to diseases that they were born with. So we can see all different types of things. Toxins, you think of it, we've seen it, and it's a potential diagnosis for these guys. So when we have a patient with elevated liver values, Luke's kicking me, really what we want to start with is not only a thorough history, but also knowing exactly what liver values are elevated, the exact numbers, and then what the symptoms are, because that's really going to point us in the right direction as far as what we might be dealing with. We're more likely to see diseases of patients where they were born with a condition when they're younger. We're more likely to see cancer the older they get. Middle age is more likely to see things like autoimmune diseases. Toxins really can happen at any age, but really having a thorough history and knowing which values are elevated can be really helpful at narrowing down what we might be dealing with. We often will start with an abdominal ultrasound to get a non-invasive look at what might be going on. It's important to remember, though, that an abdominal ultrasound is never going to replace a biopsy. Really what we're trying to do with the abdominal ultrasound is to get some clues, help to rule out structural abnormalities, figure out if the liver might be diffusely affected, whether or not there's a focal lesion, looking at blood vessels and blood flow to help to rule out congenital abnormalities. So we're really just trying to get more information so that we can plan either a test to get a definitive diagnosis or to look and see if we have enough information to start treatment. A biopsy is always going to be more definitive to know exactly what's going on. There are some diseases or disease processes where a biopsy may not be really our best option. So for instance, if we're worried about more of a congenital abnormality like a liver shunt, those are situations where we can often diagnose with some sort of imaging like an ultrasound or CT angiogram. And then we're usually doing surgery to correct that blood vessel. And so we might not have a diagnosis based on the biopsy, but we often want to get a biopsy so we can make sure there's nothing else going on. Typically, for acute liver diseases, we're thinking more of toxins. And so those might be situations where we don't want to wait for a biopsy to come back. We need to get the pet on appropriate treatment and treat and see how they respond. And then for more chronic diseases, especially diseases where there's a generalized change in the liver, or if there's a focal lesion that we want to try to remove and figure out exactly what it is, those are often situations where a biopsy is a lot more helpful. And even taking something out completely, like a liver tumor, especially if it can be fully resected, sometimes that's not only a diagnostic tool, but also a treatment at the same time. So again, an ultrasound helps us get the lay of the land to try to figure out, do we need to get a biopsy and how best to get that biopsy to get a definitive answer. There's 3 major ways of getting a liver biopsy. The first way is ultrasound guided biopsy, where essentially you're using ultrasound guidance to get a needle biopsy into the liver. That's generally done under really heavy sedation or anesthesia. And really you can only get the portions of liver that are close to the body wall. So you're not going to be able to get any structures that are deeper down in the liver or away from the surface. And your biopsy sample is going to be really tiny, so you're not going to get a whole lot of liver to really work with. The next step up is laparoscopic, which is what I prefer. And basically that involves under general anesthesia, getting 2 small incisions into the belly. One is going to be for the biopsy instrument and one is going to be for the camera, and actually our surgeons do it at the practice that I work at, but in some cases the internal medicine specialist will do it as well. And you're essentially able to get anywhere in the liver, and you're getting near surgical quality biopsies from a minimally invasive approach. And so it's a really good way of being able to get a biopsy. You can't remove anything with that technique. You can't remove anything with ultrasound guided either. But at least with laparoscopic, you're going to get a really good sample to really be able to make a diagnosis. And because you can access anywhere in the liver, you can get a representative sample. And then there's surgical biopsy, which again requires general anesthesia, and you're actually opening the pet up. We generally only recommend this approach if there's a lesion that we're going after, something that we're trying to remove in the liver, or if we're already going to be in the belly getting like a foreign body out from the gastrointestinal tract, or we're going in there for some other reason. But that's going to be your best biopsy sample, but then you have to wait for the patient to heal from an incision like that. So that's going to give you a definitive diagnosis. And not only do we want to get a sample for pathologists to tell us what's happening microscopically, but we also usually want to get a sample, we usually want to get a sample for culture to look for evidence of infection. And we also want to get a sample for copper because we do see a lot of patients that have copper storage disease or other more chronic conditions where we need to get that specialized test. Sometimes there are situations where blood tests can give us information about the liver, such as with the shunt. So we can look for different products that the liver makes or things that the liver has to recycle to look at liver function and get more information. And then there are situations where maybe we can't do all the diagnostics that we want to do, and so we have to try empirical therapy. So using treatments, treating based on what we think may be going on, and using the response to tell us if we may be on the right track. And those are situations where I usually start with least aggressive and work my way up. Basically what I want to try to do is add therapies on to existing therapies, and do it in such a way that it doesn't make something worse. So for instance, treating for toxins and infections first, then adding on anti-inflammatories and other medications to potentially suppress the immune system or decrease inflammation after we've given those liver protectants and antibiotics time to work. So it kind of increases the aggressiveness of treatment and uses that response to tell us if we're on the right track. So what kind of liver diseases do we see? So again, I kind of alluded to the fact that it runs the gamut. But we can see things like liver infections, and in many cases the infections either occur because of an ascending infection from the gut. So the gut and the liver are connected by blood vessels and then also by bile ducts. And so infectious agents can hitch a ride in the bile duct and ascend up to the liver, or they can hitch a ride in blood vessels and end up in the liver. Oftentimes, the types of infectious agents that we see are going to be, like I mentioned, gut bacteria, or sometimes we can even see skin bacteria. And in other cases, sometimes we don't know where they've gotten the infection. Maybe it's environmental and they're immunosuppressed. There's also situations where sometimes we can see parasites that can harm the liver. We can also see autoimmune diseases where basically the body is attacking the liver, leading to inflammation and dysfunction. So we can see those sorts of conditions in Dobermans. We can see that in labs. We can see that in a number of different breeds where it really just happens. So just the same way that autoimmune diseases happen in people, it can just, the immune system can get misdirected and start to attack itself. Those are diseases where we often have to use immunosuppressive medications to get the liver values under control. We can see conditions like copper storage disease where essentially there's a defect with the liver's ability to get rid of copper. And copper is in diets. Copper is really important for different enzymes, and so you want to hold on to some of it, but you want your liver to be able to get rid of what you don't need. And there are some patients that can't get rid of the copper that they store. And so what ends up happening is the stores in the liver become overwhelmed, and then all that copper starts to leach out, and that copper starts to cause liver damage and cell death. So we can see that occur. We can see cancers in the liver. So diffuse cancers, we can see solitary masses in the liver. We can see spread of cancer from distant locations. We can see systemic cancers that are in the liver and in other areas of the body. So there's all these different types of cancers that we can see. And it's not always really older patients. It can be young patients in some cases. So it really just depends on the type of cancer and unfortunately who's unlucky enough to get it. We can also see toxins, so toxins that are ingested either out in the environment like mushrooms or moldy food stuff or sugar-free gum containing xylitol. So there's all these different toxins that can affect the liver. We also can see congenital diseases like liver shunts or microvascular dysplasia that these guys are actually born with, and depending on how severe it is, we can see symptoms develop at really any age, but oftentimes it's younger patients. So there's a number of liver diseases that we see in both cats and dogs. Oftentimes we start looking because of lab tests, and then that takes us on a diagnostic search. That often includes imaging. It can include other blood tests. It could include biopsies, cultures, and again, sometimes we try medications and see how they respond. So liver disease is really not that uncommon in dogs and cats. Well, hopefully you enjoyed this intro to liver disease in dogs and cats. If you have any questions, leave a comment below. Please follow, please subscribe. I'm coming out with new videos. Let me know what else you'd like to hear about. Okay? All right. I'll see you in the next video.